Okay, I don't know quite when that happened, but part two of the uh, mood disorder lecture. We were talking about premenstrual dysphoric disorder, and we were talking about how one or more of the following symptoms must be present to reach the total of 5 symptoms uh, to be diagnosed as PDD. Decreased interest in usual activities. Okay, difficulty in concentrating, lethargy, a lack of energy, easily fatigued, a marked change in appetite, overeating, or even having specific food cravings, sleeping too much, not sleeping enough, physical symptoms such as breast tenderness or even gaining weight, significant distress or interference with work, school, usual social activities. What I've done in the past is summarize that as saying if it starts interfering with their day-to-day living activities. And that these symptoms, of course, are not attributed to another medical condition or some kind of drug use. All right. Premenstrual dysphoric disorder. It's controversial. A lot of, this is one that there's not a lot of agreement on, but the advantage of the diagnosis is it actually legitimizes the difficulty some women face when symptoms are very severe. It's not in their head. It is real. It is something that is felt. The disadvantage, it pathologicalizes an experience that many consider normal. What they don't realize is the exaggerated factor of a normal condition. Okay, disruptive mood dysregulation disorder. This is where somebody would just have severe temper tantrums, temper outbursts very frequently, but they also kind of always are in an irritable or angry mood. It's only in children. It only can occur in children aged 6 to 18. It's criteria for manic or hypermanic episodes that are not met. And it's designed in part to combat overdiagnosis of bipolar disorder in youth. Features of disruptive mood disorder, dysregulation disorder, severe outbursts occurring 3 times or more per week for at least 1 year. These can be manifested verbally, behaviorally. They are out of proportion in intensity or duration to the situation and are inconsistent with developmental level. These are just more than temper tantrums. These are super severe temper tantrums. And the mood between temper outbursts is persistently irritable. They're angry most of the day, nearly every day. And this being angry all the time and the anger outbursts occur in at least 2 of 3 of the following settings: home, school, or with peers. It's severe in at least one of these settings. The diagnosis should not be made for the first time before the age of 6 years of age or after 18 years of age. There has never been a distinct period lasting more than 1 day during which the full symptoms criteria, except duration, for a manic or hypermanic episode have been met. And the symptoms are not attributable to a physiological effect of a substance or a medical condition. All right, let's talk about bipolar. Now remember, bipolar is the name for what was formerly called manic depression. Now, many times when bipolar disorder becomes a psychotic disorder, it can be confused for schizophrenia. So the doctor has to really take time and look at the history, look at the onset, look at the family history. There's a lot of things that the doctor really needs to be careful about and make sure that if he diagnoses them as schizophrenic, they're not schizophrenic, and if he diagnoses them as bipolar, that they're truly bipolar. Okay. Now, bipolar 1 is when they alternate between a full manic episode and a major depressive episode. This is what we used to call the manic depression. You have those gigantic mood swings, okay? The average onset is about 15 to 18 years, but it can begin in childhood.